Over or
all right, John, hold on a second. Kate Baldwin has got some information. Kate, go ahead. Tell us what's going on.
This is our first reading. We're still going through the reading, the opinion, but I want to bring you the breaking news that according to producer Bill Mears, the individual mandate is not a valid exercise of the Commerce Clause. So it appears as if the Supreme Court justices have struck down the individual mandate, the centerpiece of the health care legislation. I'm going to hop back on this phone to try to get more information for you and bring it right to you, Wolf.
Wow, that's a dramatic moment. If, in fact, the Supreme Court has ruled that the individual mandate is, in fact, unconstitutional, that would be history unfolding right now. We're going to get a lot more information. This is just the initial headline that we're getting from inside the Supreme Court to our own Kate Baldwin. John King is outside the Supreme Court watching all of this unfold. What a setback, John, this would be for the president, for the Democrats, those who supported this health care law. If they rule that the individual mandate is in fact unconstitutional, then it raises questions about any of this health care reform law.
Wolf, the individual mandate is the centerpiece of the policy, meaning the mandate requiring most Americans to purchase insurance is where the money comes from. It's how you expand access. The administration has said it could possibly try to keep parts of the law viable, but it is the money. Most of the money comes through that individual mandate requiring people to purchase health insurance. The court striking down that mandate is a dramatic blow to the policy and to the president politically. And that has been the defining and was the defining debate in Congress. Does the federal government have the right to tell individual Americans you must buy this? Does the federal government have the right to tell the 50 states you must set up a system with these insurance pools, with these co-ops to implement the Affordable Care Act? So the justices have just gutted, Wolf, the centerpiece provision of the Obama health care law. The question now is what else do they say in this ruling, and can parts of the law be salvaged? The administration has been stressing this morning there are other popular provisions that even if the mandate is struck down, they believe will be left in place by the court. But without a doubt, the individual mandate, which has been the polarizing centerpiece of the political and policy debate over health care, the justices throwing that out is a direct blow to the President of the United States, a direct blow to his Democratic Party, and this is a victory, if you will, for the conservatives. A victory. Go ahead.
Hold on for a second, John. I want to bring Dr. Sanjay Gupta, our chief medical correspondent, into this. If the individual mandate, Sanjay, is not a valid exercise of the Commerce Clause, if in fact it's unconstitutional, as John King was saying, that's supposed to pay for health insurance for a lot of poor Americans because healthier, younger Americans would be forced to purchase health insurance, and the revenue that would come in would help provide insurance to millions of others. Give us your initial reaction to this breaking news.
Well, it's obviously very important. The second most important piece of information I want to hear now is what happens to these, quote, non-discriminatory clauses against patients who have chronic illness. Wolf, you know, the people who are paying the most attention to this right now are people who have some sort of illness and have been unable to get health care insurance, or the health care insurance has been too expensive for them. Again, as you just point out, the way that they were going to be able to get health care insurance, the way it was all sort of portrayed was the new people coming into the system under the mandate were going to help pay for them. That money is no longer there. So now we want to hear from the Supreme Court, are they also getting rid of these non-discriminatory clauses as well? Wolf, you know, regardless of what they do at this point, I think the point that John King was making is that from a pragmatic standpoint, from the standpoint of a doc like me who works in a public hospital, you know, if you can't pay for this, I don't know how it works, even if the law is on the book. So it's a very big deal here, Wolf. This particular of the 450 provisions, this one obviously was the centerpiece on which so many of those other ones were riding.
Yeah, if in fact that's the final word on the individual mandate, it could be a little bit more complicated. John King, you're getting some more information as well. We're watching all of this unfold. We're still trying to dissect what this initial report we're getting from inside the Supreme Court means.
And, Wolf, that is the key point in the details. If they rule the mandate part unconstitutional, if the federal government has that authority, what about the other provisions? Can it stand as a taxing provision? So we'll get the headline from the court tells us one thing, but we have to get deeper into the decision to find out whether they left all or part. There are severability clauses at stake. So until we can read every bit, until we get access to every piece of the decision, it is hard to say the impact. Certainly, if the court has struck down the individual mandate, they take out the giant, the organizing piece, if you will, of the Obama health care law. But how the justices word their decision is critical as to whether any or all of the part of the law stands going forward.
Yeah, and as I say, there's some confusion out there, conflicting reports coming in from inside the Supreme Court. So let's hold off on drawing any final conclusions on what exactly the 9 justices of the U.S. Supreme Court have decided. Initial suggestion that perhaps the mandate, the individual mandate, not a valid exercise of the Commerce Clause of the Constitution, but now there are other reports saying that perhaps the tax that would be imposed on those who refuse to purchase health insurance but could get Chief. We're now getting more information, and I just want to update our viewers. The Chief Justice, John Roberts, saying potentially the individual mandate could be upheld as a tax, but we're getting some conflicting information on what leads up to that. So let's take a deep breath and let's see what the justices actually decide. Could be a little bit more complicated than initially thought. All of this unfolding. If you're watching Twitter, you can get some of the confusion as well, because we're getting widely different assessments of what the United States Supreme Court has decided. So let's wait and see. We have our producer Bill Mears inside. Kate Baldwin is getting that information directly from Bill Mears, so we'll see what is happening. But this is a momentous occasion. John King is watching all of this unfold as well. John, what else are you picking up?
Wolf, just waiting for more of the decision. You can hear the protest behind us.
Hold on, John. Kate Baldwin's getting some more information. All right, Kate, what are you learning?
Bill, I got to tell you, this is a very confusing, very large opinion, but I want to make sure we are very clear. On the second read, we found here, and I'm going to read you the exact line. Chief Justice John Roberts delivered the opinion of the court with respect to Part 3, that is the individual mandate, concluding that the individual mandate may be upheld as within Congress's power under the taxing clause. What we are reading here is that the individual mandate may be upheld under a narrow reading of the Constitution, not under the Commerce Clause. We're talking about the taxing clause. Wolf, very important distinction here. As you can see, this is very thick, and we're reading through it. It's very legally dense. I'm going right back to it to find out about the rest of it.
Yeah, because there were conflicting assessments from the Obama administration whether in fact this is a tax or not a tax. The penalty that would be imposed on those who have the ability to buy health insurance would be required to buy health insurance, but still decided not to do so, whether or not that would be a tax or not a tax. So you just heard Kate say that the Chief Justice, John Roberts, saying that, yes, under the tax provisions, under the tax writing provisions of Congress, and the president would sign it into law, that this would be allowed. That was not necessarily the argument that was made by the Obama administration. They didn't necessarily say it was a tax. They thought it was a Commerce Clause provision, which is different. John King is joining us right now. Kate Baldwin's getting some more details. What else are you learning, Kate?
As we're reading through this again, we are reading now that the entire law has been upheld, Wolf. We are reading through this to see how the count, how the vote count went within the justices, because it looks like there are a lot of differing, concurring, and maybe even pluralities here. But from what we are reading here, it looks like the entire health care law, including the individual mandate, has been upheld.
And that explains why the Chief Justice initially, in one of the lines that we reported, said that the individual mandate might not be appropriate with the Commerce Clause of the Constitution, but he does say it is appropriate. It is being upheld as part of the tax writing ability of the Congress to go forward and impose taxes. If, in fact, that is the justification, then it's a huge, huge victory for President Obama and for the Democrats, who worked very, very hard to enact the health care reform law, what the critics have often called Obamacare. But if the Chief Justice says, and he is the decider, obviously, in this, if the Chief Justice, John Roberts, says that the Affordable Care Act is, in fact, constitutional, that the individual mandate is constitutional, provided in accordance with the tax writing ability of the U.S. Congress, then obviously a big, big victory for the Obama administration and President Obama himself. Some of the